what I'd like to talk about for a few minutes is how do we treat alcoholic disease? That's very interesting because there's different components to treatment. One would be a medical component, and then, of course, there's a counseling component. What happens with alcohol is alcohol affects what are called the GABA receptors, which are inhibitory, and it quiets down the brain. So when somebody stops drinking alcohol, what happens is that the inhibitory response, the inhibitory actions on the brain are taken away, and then the brain becomes overexcited. So there's a role for medical treatment, and there are three FDA-approved medications. One would be Naltrexone, or in the depot injection, the once-a-month injection. That would be the trade name is Vivitrol. But what that does is it works on the opioid receptors, and the opioid receptors are the pleasure receptors of the brain. And so when you have a drink, dopamine is your happiness neurotransmitter, your reward neurotransmitter, and your dopamine levels go up. So when your dopamine levels go up, you're thinking, this is a good thing, I'm reinforced, and I'm going to do more of it. And so that's why people can go from one drink, like the easiest drink to give up is the first. After you have the first, it's a lot harder to give up drink 2, 3, 4, 5, 6, 7. But what naltrexone does is it attenuates the dopamine surge, so we don't have as much of a reward from having a glass of alcohol as we would have had naltrexone not been on board. So in that situation, it's not going to make you sick when you drink, but on the other hand, with time, hopefully, that we don't want people to be drinking. We want people to stop drinking by the time they get to there. But if they're going to have a drink, the reinforcing capabilities are going to be lessened, and hopefully it'll get to the point where people just think, nah, I just don't need it. The second drug is acamprosate, and acamprosate is a medication that acts on glutamate receptors, and glutamate receptors are excitatory receptors. So, what it'll do when the brain goes into excitatory overdrive, it'll quiet down the brain a little bit and prevent the overutilization of resources by neurons. It also is 100% metabolized through the kidneys, so even in a very damaged liver, we can use acamprosate. The third drug that is FDA approved is disulfiram, or antabuse. That breaks down the metabolism of alcohol so that instead of breaking down the alcohol appropriately, it'll build up as acetaldehyde, and it'll make people very sick. The negative thing about that is if people want to drink, you don't take the pill. If you could somehow find a depot shot to give once a month, that would seem like a very interesting concept, but I don't know if the medication could be formulated in that fashion. I don't have any expertise in that regard. And then there are other things that are not FDA approved, and but they do have efficacy, and one would be Neurotin, which is gabapentin. Gabapentin does not work directly on the GABA receptors, but in that vicinity. So we're trying to work the same system. Or Lyrica, which is pregabalin, and GABA again. So these medications may be helpful. A lot of people in the short term, may want to go with benzodiazepines, which are like Valium type medications, Xanax, Ativan, things like that, because they work on the same GABA A receptors as alcohol. So when you take something off, you're putting something back on. But that's not a long-term answer. And because of the fact that you're going to get a benzo habituation / addiction, and then that's a very difficult, life-threatening withdrawal, as is alcohol. Now, once you start to get into the medications, it's not just medicating somebody that is going to be the key to long-term sobriety. It has to be in conjunction with counseling and or AA. You have people's lives have become very small a lot of time with substance use disorders, and they don't have a lot of help in their own private circles. But counseling you got to learn how to do things a different way. You can't just go about doing things the same way you've always been doing it and then expect this time it's going to succeed. The odds are against you. So we look at counseling as being very important with medical care, because the medical care is to try to keep you stable, but the counseling is to educate you on how to produce better results going forward in the future.